Hello guys, welcome back to my YouTube channel, Hair Really. This is Faisal. I'm here today with Darren from PAI Medical Group, We Grow Hair Indy, and we're gonna go over some really important information. Alright Darren, can you please tell us more about you, what you do, and just...
So I'm the clinic director here, so I run the medical part of the business. I've been involved for about 15 years. Originally from New Zealand, I'm 46 years old now. I had my hair transplant when I was 31 years old, so this was me. I know Hazel's seen that before, so that was me pre-transplant. Obviously my hair color is a bit different these days, but I had the multi-unit hair grafting procedure. As you probably know, we do other things as well, but that was what was right for me. I've had one procedure, I've done some things to keep my non-transplanted hair as well, but my hairline stayed in place and they just transplanted right through the top. My hairline kind of a different deal than yours, as you know, because mine was already there. And I can't carry this youthful low hairline that you can, unfortunately. So my focus is the transplant side of things. I'm very passionate about what I do, and very fortunate. We have a busy clinic here and a great business, and we love helping people.
Awesome. Thank you. Yes. So yeah, you got a hair transplant years ago. So what are you doing to maintain your existing hair?
But even with that said, my non-transplanted hair is still at risk of future loss. So I've done things to maintain that. So I've been very regimented. I've done Rogaine, I've done Propecia, which was prescribed by the physician. And I've done that for about 13 to 14 years. In the last 2 to 3 years, I've done a little bit of plasma treatment, the PRP treatment, because I found that my Rogaine and Propecia were losing some of their effectiveness, which over time, sometimes they can. So the PRP has just helped to reinforce that existing hair. I may need another transplant at some point in my life, because sometimes even those things might lose a little bit of effectiveness. But as I said, other than being a little bit more grey than it used to be, it's still doing pretty well. So I'm happy with it.
Yeah, amazing.
Thank you.
Really good. So that's amazing. So can you please tell us, so I'm on almost like day 10, I would say, because I got it last Saturday, got my hair transplant. Can you just educate us and tell us what, should I be doing?
So this is the first time I've seen him for 2 or 3 days. Guys, this looks perfect. So it's actually day 9, and what we tell people is you're going to have little tiny crustal scabs up there for the first 7 to 10 days. The average person, healthy guy, follows the directions post-transplant, all little crusts and scabs are gone around about 7 to 8 days. Classic example right here. Now what Faisal still has is some of the little hairs that were transplanted. If you read the textbooks and the fine print, it tells you when the crustal scabs come out or come off, the hair should actually fall out with them, but the seed or the bulb, that's the important part, sits under the surface. Okay. That follicle then goes into a resting stage. It takes 2 to 3 months for that hair to regrow. Now, the hair you've got up there now, that'll probably still fall out. You might feel like it's growing. It's actually going to push its way out. With the procedure being less stressful on the follicles now, we tend to get a lot more guys that hair doesn't initially fall out with the scabs. It just stays there like this does. Now, you may get lucky and some of this may grow right away, but often this will still fall out. But this is textbook at this stage. At 9 days, it's absolutely perfect. Some of the hair has fallen out, but a lot of it is still there, and it's perfect. So everything is gone exactly to text as it should here.
It's really, that's really good to hear. Because obviously, I was just worrying about what's going on. I was like, am I doing the right thing? So it's okay to see some hair falling out with a crust after the procedure. So
it's one of the most common questions I get.
Yes.
With text and callers, there's hair coming out in the scabs. That's normal. If you actually grab something here, guys.
Yes.
If you actually think about this little model, right? How closer we can see as we come in here. Down the bottom of the model here is what we call the papilla, or the hair seed, if you like. And that papilla, this whole area is transplanted. And when we transplant it, we move the whole infrastructure. After the transplant, the hair sheds, it falls out. Then the follicle stays under the surface, the seed or the bulb. That goes into a resting stage for 2 to 3 months. So it's normal to see some of those hairs in the scabs when they come off. A lot of people ask me, how do I know if I've damaged a graft? That's unusual. But if it bleeds when a scab comes off, and it bleeds fairly well, like running down the forehead, you may have been premature in getting that scab off. But with the hair being in it, it's totally normal. It's a normal thing to see.
Normal thing.
Yeah.
Okay.
Yeah.
Perfect.
Totally normal.
And we said like it takes approximately 7 to 14 days for all the crust to fall off.
Yeah, normally 10 days is
10 days.
about the max. Yeah, so as you know, I think tomorrow you're coming in for your suture removal. Normally if we see somebody, or Wednesday, if we see somebody at the suture removal, which is on average 10 days afterwards, and they still have some little scabs up there, we will remove them or speed them along. A lot of guys that we see, you come in and you've been a little passive with the scabs, which is understandable because you don't want to touch them. We give pretty detailed directions, but there comes a point where you have to actually start to encourage them to come off a little bit. So the washing, doing it the right way. I had 2 guys yesterday that reached out to me, it's day 5 for them. Am I being too aggressive with the scabs? So this is perfect though, guys. I mean, this is absolutely perfect. So, and incidentally, if he wanted to mask this, you could actually put a little product or fibers in there to blend that away. Obviously, you're being really public about it, so
Yes.
it doesn't matter. It looks perfect, absolutely perfect.
Can you tell me more about the fiber? Because
Yep.
I'm pretty familiar with it, but I'm sure some people are not, and they might be interested.
Yeah, so a lot of people ask me what's the perfect time to have a hair transplant. There's no perfect time, but everyone's busy, right? So you got to try and work it into your schedule, but sometimes you also have to work around things you've got going on, right? So if we have a lot of people that have meetings or are busy, they're in front of people after a week or so, there's a product called Topic, which is an artificial hair fiber that we can match to hair color that we can shake into the transplanted area, which basically blends it away. So we can match it to your existing hair color and shake it into the transplant area so that visually people don't, your eye isn't drawn to the transplant area, so it's easy to camouflage the area that's been transplanted. And here's the interesting thing, I noticed when I had my transplant, people don't look at us in the same way we look at ourselves.
Right.
So it's like when you have hair loss, people look at you and we think they're looking at our hair. All I could think about was, oh my God, that guy's looking at my hair.
Right.
It's actually not. Well, it's just kind of the same after a hair transplant. In that it's easier to mask and camouflage than you think. And there are ways that we can plan pre-transplant by growing your hair a little bit longer as well. But it's a great product. The Topic artificial hair fiber is really good.
Oh, wonderful.
Really neat. Yeah.
That's awesome. So what can someone do after a hair transplant to maintain their existing hair and to kind of help reduce hair loss?
Yeah, there's
some non-surgical.
Yeah, so that's a great question, and whenever we talk to somebody, we talk about what we call a global approach. Obviously, putting back the hair you've lost is the transplant, but keeping what you've got, and there are 3 or 4 medical options that we promote as working. Rogaine, which most people have heard of, FDA approved for the crown area. There is a rollover effect to the front a little bit, particularly after a transplant if we've transplanted into that frontal area. And there is a right way and a wrong way to use Rogaine. We can talk about that at a later point. Finasteride, which is a medication prescribed by the physician, which some guys don't want to take a medication every day. There can be side effects with that, so you have to be comfortable taking it. In my situation, I am. Laser hair therapy. Now, one of the reasons you look as good as what you do right now and as advanced from a healing point of view is laser therapy. So laser hair therapy is a cool low-level laser light. It's FDA approved. It helps reduce inflammation, helps healing of scar tissue, and it expedites the regrowth of the transplant hair by shortening the resting cycle of the hair follicle. So you'll have a number of patients in here at any one time sitting under a laser or doing some laser therapy at home with the at-home devices, which do work, they are helpful. The efficacy is not quite as good as the commercial versions that we have here in the clinic. And then lastly, platelet-rich plasma, PRP, using your own platelets, very popular now. The benefit of not having to come to the clinic multiple times. And it actually utilizes your own growth factors in your platelets to help rebuild cells and attract stem cells to the base of the hair follicle. So those are the 4 things that are kind of medically proven. Shampoos and topicals can help, but they're not directly targeting the genetic reason for the hair loss. So it's a global approach.
Right. So awesome. So we have like about 4 options: laser hair therapy, Rogaine, PRP,
Yep.
and
Finasteride.
Finasteride. It's a hard word to say for me. But I'm getting the laser therapy done, and I have a video about it. I'll try to put it in the description box, so make sure you check that out. And PRP will be perfect for people who are super busy or like want low maintenance, like a solution that's low maintenance. That's like a perfect
it is.
route for them.
Yeah, we also use that for people in the early stage of hair loss. So, like when you first came in for the consultation, we talked about, what's your goal? If your goal had been just to maintain what you have and not bring the hairline down, platelet-rich plasma, the PRP, would have been an option. We don't just use straight PRP. We'll often add an additive to that platelets, to the plasma, to help to reinforce it. If you're just using your straight platelets, then that's really targeting healing and recovery at the time of the transplant, and does a nice job of that as well. So we try and encourage guys to be as global as possible, and the benefits of the transplant types we use is that we can transplant a lot of hair in a single procedure, but although it minimizes the chance for future transplants, it doesn't mean you'll never need one. So those modalities help to just act as an insurance policy, if you like, so far as controlling future loss of the hair that's not transplanted.
That's awesome. Yep. So it's really great to know that we have a lot of options out there right now, and they're effective solutions. And we are all different, and everybody experiences hair loss differently.
Yeah.
And maybe like that solution that the clinic provided for me won't be suitable for some people. So it's good to do your own research and go talk to somebody. Most of consultation in clinics are complimentary. So just take advantage of that. Go talk to somebody that knows about hair loss, and so they can give you the best solution that would work for you. Yep.
Yeah, tailoring what you do is really important. So, part of that consultation process should involve a microscopic analysis where we're taking a microscope and looking at the hair on the back of the scalp. That's the healthy, strong hair, and we're also comparing that with the hair on top. So we have a baseline with regards to the healthy hair in the back, and then we compare it to what's going on the top, because what the human eye can see and what you can see under magnification are two different things. So we're thinking about not just how your hair loss is now and how it's going to be in a year's time, we're also thinking about how it's going to look in 5 years, 10 years, 15 years, and so on, right? So we're thinking longer term, not only the way we transplant, but also what you can do to maintain and keep what's already up there. It's going to ensure that you're hair happy for as much of your life as you can be, which is obviously important.
Absolutely.
I just want to say I'm not a physician, but I'm one of the clinic directors, so I work very closely with our physicians. I make that clear to everybody. But I do spend a lot of time with people, and I'm very, very proud of what we do, and I've had a great time working with Faisal. So looking forward to it continuing to grow in.
Yeah, thank you, Darren, and I'm sure you guys will see Darren again on my channel. So watch out for his videos with me. Thank you guys for watching this video. Don't forget to like and subscribe, and I'll see you guys on my next video. Have a nice day.